If you've survived one stroke, your risk of having a second stroke is terrifyingly high. Research from the journal Stroke shows that approximately 25 to 40% of stroke survivors will have another stroke within 5 years. For people over 70, the risk is even higher. Approximately 1 in 3 stroke survivors over 70 will experience a second stroke within 3 years of their first. What makes second strokes particularly deadly is that they're often more severe than the first. The brain has already been damaged by the initial stroke. Blood vessels are diseased. Circulation is compromised. When a second stroke occurs, it frequently causes more extensive brain damage, greater disability, and higher mortality than the first stroke. As neurologists who have treated thousands of stroke patients over 40 years, we see preventable tragedies repeatedly. Patients survive their first stroke, they recover partially, they return home. Then weeks or months later, they experience warning symptoms of an impending second stroke, but don't recognize them or dismiss them as minor. By the time they reach the emergency room, hours have passed. The window for clot-busting medications has closed. The damage is done. Research from JAMA Neurology examined time from symptom onset to hospital arrival in second stroke patients. Studies found that stroke survivors took longer to seek care for second stroke symptoms than they did for their first stroke. Many assumed symptoms were temporary, related to their previous stroke, or not serious enough to call 911. This delay proved fatal for many. The critical fact is that many second strokes are preceded by warning symptoms hours to days before the major stroke occurs. These warning symptoms, called Transient Ischemic Attacks, or TIAs, are temporary interruptions in blood flow to the brain lasting minutes to hours. TIAs cause stroke-like symptoms that resolve completely, leaving no permanent damage. But TIAs are emergency warnings that a major stroke is imminent. Studies show that 40 to 50% of people who have TIAs will have a major stroke within 48 hours if not treated immediately. The TIA is your brain's final warning. Ignore it, and you may not get another chance. In this video, we'll examine 9 warning symptoms indicating a second stroke may be developing in people over 70. Number 5 appears so subtle that 70% of patients dismiss it, yet it indicates a stroke is actively occurring in your brain right now. Number 1 is the most common warning, but is frequently attributed to other causes, delaying treatment until it's too late. These aren't vague symptoms. These are specific, recognizable changes demanding immediate 911 calls. Every minute matters. Medical references appear in the description. Understanding these warnings saves your life. Now let's examine what your brain is telling you when a second stroke threatens. Warning symptom number 9, sudden severe headache unlike any headache you've experienced before. Warning symptom number 9 is sudden severe headache, often described as the worst headache of your life. This symptom is particularly concerning in stroke survivors because it may indicate a hemorrhagic stroke, where a blood vessel ruptures and bleeds into brain tissue. Hemorrhagic strokes account for approximately 15% of all strokes, but cause 40% of stroke deaths. They're particularly common as second strokes in people who had ischemic strokes first and are taking blood thinners to prevent clots. The blood thinners that protect against clot-based strokes increase bleeding risk. The mechanism is straightforward. When a blood vessel ruptures in the brain, blood accumulates in the confined space inside the skull. This accumulated blood creates pressure on brain tissue. The pressure causes severe headache and progressive neurological damage as brain structures are compressed. Research from the New England Journal of Medicine examined hemorrhagic stroke presentation. Studies found that sudden severe headache was present in 80 to 90% of hemorrhagic stroke patients. The headache typically reached maximum intensity within seconds to minutes, quite different from migraine or tension headaches that build gradually. Patients describe the headache as explosive, like being struck by lightning or hit in the head with a bat. It's often accompanied by nausea, vomiting, sensitivity to light, and neck stiffness. Some patients lose consciousness immediately. What you must do if you experience sudden severe headache is call 911 immediately. Don't take pain medication and wait to see if it improves. Don't drive yourself to the hospital. Call emergency services. Hemorrhagic stroke is a medical emergency requiring immediate brain imaging with CT scan and potentially emergency neurosurgery to stop bleeding and relieve pressure. Emergency physicians will assess you rapidly, perform CT scan within minutes of arrival, and consult neurosurgery if bleeding is found. Treatment may include medications to reverse blood thinners, blood pressure control, and surgical evacuation of blood clot if the hemorrhage is large. Time is critical. Every minute of delay allows more bleeding and more brain damage. Survivors of hemorrhagic stroke who reached the hospital within 1 hour had significantly better outcomes than those who delayed. Warning symptom number 8. Sudden vision problems, including blurred vision, double vision, or vision loss in one or both eyes. Warning symptom number 8 is sudden vision changes. Vision problems indicate that stroke is affecting the occipital lobes at the back of the brain, where visual processing occurs, or the brain stem, which controls eye movements. Several types of vision changes occur in stroke. Blurred vision or dimming in one or both eyes suggests reduced blood flow to the retina or visual cortex. Double vision, called diplopia, indicates brainstem stroke affecting the cranial nerves controlling eye muscles. Sudden vision loss in one eye, called amaurosis fugax, suggests a clot or plaque fragment temporarily blocking the retinal artery. Hemianopia, loss of vision in half the visual field of both eyes, indicates stroke in the visual cortex. For example, you might lose vision in the right half of both visual fields, meaning you can't see anything to your right side. This occurs when stroke damages the left occipital lobe. Research from ophthalmology examined vision problems in stroke patients. Studies found that 20 to 25% of stroke patients experience vision changes as an early or presenting symptom. Critically, vision changes often preceded other stroke symptoms by minutes to hours, providing a warning window. Many stroke survivors dismiss vision changes, especially if they resolve quickly. They assume their eyes are tired, they need new glasses, or it's related to their previous stroke. But any sudden vision change in a stroke survivor is an emergency. What you must do if vision suddenly changes is call 911 immediately. Don't wait to see if it improves. Vision changes indicate blood flow to critical brain areas is compromised. Even if vision returns to normal within minutes, you've had a TIA and are at extreme risk for major stroke within hours. Emergency physicians will perform brain imaging with CT or MRI, assess blood vessels with CT angiography or ultrasound, and potentially start or adjust blood thinners or blood pressure medications. If a blocked artery is found, you may be candidate for clot removal procedures if you arrive within the treatment window. Warning symptom number 7. Sudden numbness or weakness in face, arm, or leg, especially on one side of the body. Warning symptom number 7 is the classic stroke symptom that everyone should know, but many people still ignore when it happens to them. Sudden numbness or weakness in the face, arm, or leg, particularly affecting one side of the body, indicates stroke affecting the motor cortex or internal capsule, brain areas controlling movement. The pattern is characteristic. Stroke typically affects one side of the brain, causing symptoms on the opposite side of the body. A stroke in the left brain hemisphere causes right-sided weakness. Right hemisphere stroke causes left-sided weakness. This occurs because nerve fibers cross from one side of the brain to the opposite side of the body as they travel through the brainstem. Facial weakness causes one side of the face to droop. The mouth droops on one side. Smiling looks asymmetric. Arm weakness makes it difficult or impossible to lift one arm. Leg weakness causes dragging or difficulty walking. In severe strokes, the entire side of the body becomes paralyzed. Research from Circulation examined stroke symptom recognition. Studies found that 90% of stroke patients experienced facial weakness, arm weakness, or leg weakness. These motor symptoms were the most common presenting features, yet surveys showed that 40% of people experiencing these symptoms didn't immediately recognize them as stroke and delayed calling 911. The delay occurs because symptoms sometimes start mild and progress gradually. You notice your hand feels slightly weak or numb. You think it will pass. Over minutes to hours, the weakness worsens until it's undeniable. But those lost minutes dramatically reduce treatment options. What you must do is use the FAST test immediately if you notice any weakness or numbness. FAST stands for face, arms, speech, time. Face, ask the person to smile. Does one side droop? Arms, ask them to raise both arms. Does one drift downward? Speech, ask them to repeat a simple phrase. Is speech slurred? Time, if any of these signs are present, call 911 immediately. Don't wait to see if symptoms improve. Don't drive to the hospital. Call 911. Paramedics can assess you, notify the hospital that a stroke patient is coming, and transport you rapidly to a stroke center where treatment begins the moment you arrive. For ischemic strokes caused by blood clots, clot-busting medication called TPA can be given within 4.5 hours of symptom onset. Mechanical clot removal procedures can be performed within 6 to 24 hours, depending on the situation, but these treatments are only possible if you arrive quickly. Warning symptom number 6: sudden difficulty speaking or understanding speech. Warning symptom number 6 is sudden speech problems called aphasia. Speech difficulties indicate stroke affecting language centers in the brain, typically located in the left hemisphere for most people. Two main types of aphasia occur. Expressive aphasia, also called Broca's aphasia, makes it difficult or impossible to form words and sentences. You know what you want to say, but cannot get the words out. Speech becomes halting, effortful, and fragmented. Receptive aphasia, also called Wernicke's aphasia, impairs understanding of language. You can speak fluently, but what you say doesn't make sense. You cannot understand what others say to you. Global aphasia affects both expression and comprehension. You cannot speak clearly and cannot understand speech. This indicates large stroke affecting multiple language areas. Research from Brain examined aphasia in stroke patients. Studies found that 20 to 40% of stroke patients developed aphasia, depending on stroke location and severity. Aphasia was particularly common in left hemisphere strokes. Patients with aphasia often had other symptoms, including right-sided weakness, but aphasia was sometimes the only initial symptom. Family members often notice speech problems before the patient does, especially with receptive aphasia, where the patient doesn't realize their speech makes no sense. The patient becomes frustrated when family members don't understand them or don't respond appropriately. What you must do if speech suddenly becomes difficult is call 911 immediately. Don't dismiss it as stress or fatigue. Sudden speech changes indicate stroke until proven otherwise. Even if speech returns to normal within minutes, you've had a TIA requiring immediate treatment. Emergency treatment for stroke-related aphasia is the same as for other stroke symptoms: rapid brain imaging, identification of stroke type, and appropriate treatment with clot-busting drugs or clot removal procedures if eligible. Long-term outcomes for aphasia depend on stroke severity and location. Some patients recover speech completely. Others require months to years of speech therapy. Some never fully recover. But early treatment minimizes brain damage and maximizes recovery potential. Warning symptom number 5: sudden severe dizziness, loss of balance, or difficulty walking. Warning symptom number 5 is the symptom most commonly missed and misattributed. Sudden severe dizziness, loss of balance, or difficulty walking indicates stroke affecting the cerebellum or brainstem, areas controlling balance and coordination. The cerebellum at the back of the brain coordinates movement and maintains balance. The brainstem connects the brain to the spinal cord and contains centers controlling vital functions, including breathing, heart rate, and consciousness. Strokes in these areas are particularly dangerous because they can affect life-sustaining functions. Cerebellar strokes cause severe dizziness, described as the room spinning violently, called vertigo. Walking becomes impossible without support. Standing causes falling. Nausea and vomiting are common. Some patients cannot coordinate hand movements to feed themselves or button clothing. Brainstem strokes cause similar balance problems plus additional symptoms, including double vision, difficulty swallowing, slurred speech, and sometimes altered consciousness. Basilar artery stroke, affecting the main artery supplying the brainstem, is particularly lethal, with mortality exceeding 80% if not treated immediately. Research from stroke examined posterior circulation strokes affecting the cerebellum and brainstem. Studies found that dizziness was the presenting symptom in 60 to 70% of these strokes. Critically, patients and even some healthcare providers frequently misdiagnose these symptoms as inner ear problems, benign vertigo, or dehydration. The misdiagnosis occurs because isolated dizziness without weakness or speech problems doesn't immediately suggest stroke. Patients wait at home hoping dizziness will resolve. They go to urgent care where they're diagnosed with vertigo and sent home with anti-nausea medication. Hours or days later, major brainstem stroke occurs. What distinguishes stroke-related dizziness from benign causes is severity and associated symptoms. Benign vertigo from inner ear problems causes spinning sensation, but you can still walk with support. Stroke-related dizziness is so severe that standing is impossible. Additionally, stroke-related dizziness is often accompanied by double vision, slurred speech, numbness, or difficulty swallowing. What you absolutely must do is call 911 immediately if you experience sudden severe dizziness, especially with other symptoms. Don't assume it's vertigo. Don't wait to see if it improves. Posterior circulation strokes are easily missed even in hospitals. Getting to a comprehensive stroke center where neurologists can perform specialized testing is critical. Brain MRI is more sensitive than CT for detecting cerebellar and brainstem strokes. If CT is normal but symptoms strongly suggest stroke, MRI should be performed. Treatment depends on stroke type but may include clot-busting medication or mechanical clot removal. Warning symptom number 4. Sudden confusion or difficulty understanding what's happening around you. Warning symptom number 4 is sudden confusion, disorientation, or difficulty processing information. Confusion indicates widespread brain dysfunction or stroke affecting areas critical for consciousness and cognition. The confusion isn't subtle. Patients suddenly don't know where they are. They can't remember the date or what day it is. They ask the same questions repeatedly. They become agitated or combative. Some become abnormally sleepy and difficult to wake. Multiple stroke mechanisms cause confusion. Large strokes affecting dominant hemisphere language areas impair comprehension, leading to confused responses. Multiple small strokes affecting both hemispheres cause diffuse brain dysfunction. Basilar artery strokes affecting the brainstem can alter consciousness. Research from neurology examined altered mental status in stroke patients. Studies found that confusion or decreased level of consciousness was present in 40 to 50% of patients with major strokes. Confusion often preceded other obvious symptoms by hours, particularly in brainstem strokes. Family members frequently assume confusion is dementia worsening, medication side effects, or dehydration. They don't recognize it as a stroke symptom. The key distinguishing factor is acuity. Dementia worsens over months. Stroke-related confusion develops over minutes to hours. What you must do is call 911 immediately if confusion appears suddenly. Assume stroke until proven otherwise. Emergency evaluation with brain imaging identifies the cause and allows appropriate treatment. Warning symptom number 3. Sudden difficulty swallowing or choking on food or liquids. Warning symptom number 3 is sudden difficulty swallowing, called dysphagia. Swallowing problems indicate brainstem stroke affecting cranial nerves that control throat and esophagus muscles. Dysphagia causes choking on food or liquids, coughing while eating or drinking, feeling that food is stuck in the throat, and sometimes drooling or inability to control saliva. Severe dysphagia makes eating and drinking impossible. The danger is aspiration, where food or liquid enters the airway instead of the esophagus. Aspiration causes pneumonia, a major cause of death after stroke. Research shows that 50 to 70% of acute stroke patients have some degree of dysphagia. Those with dysphagia have 3 times higher mortality than those without. What you must do if swallowing suddenly becomes difficult is call 911. Don't try to eat or drink. Dysphagia indicates possible brainstem stroke requiring immediate treatment. Warning symptom number 2. Sudden numbness or tingling around the mouth or on one side of the face. Warning symptom number 2 is subtle but critical. Sudden numbness or tingling around the mouth or on one side of the face indicates stroke affecting sensory pathways. This symptom is often dismissed as anxiety or dental problems, but indicates brain blood flow compromise. Facial numbness accompanies other stroke symptoms, including weakness or speech problems. Isolated facial numbness can be the only warning of impending major stroke. Research shows that 15 to 20% of TIA patients experienced isolated sensory symptoms, including facial numbness. What you must do is call 911 if facial numbness appears suddenly. Even if it resolves quickly, you need immediate evaluation. Warning symptom number 1, sudden weakness or heaviness in one arm or leg that comes and goes over minutes to hours. The number 1 warning symptom is intermittent weakness or heaviness in one arm or leg that comes and goes over minutes to hours. This symptom indicates TIAs, temporary blood flow interruptions, warning that major stroke is imminent. Patients describe their arm or leg feeling heavy or clumsy for a few minutes, then returning to normal. This happens repeatedly over hours or days. Most patients don't seek care because symptoms resolve, but each TIA is a warning that blood flow is critically compromised. Research from Lancet Neurology found that patients experiencing multiple TIAs had 30 to 40% risk of major stroke within 48 hours. The TIAs are your brain's final warning. What you absolutely must do is call 911 immediately after even one episode of arm or leg weakness, even if it resolves. Don't wait for symptoms to persist. Emergency treatment, including imaging, blood thinners, and sometimes procedures to open blocked arteries, can prevent the major stroke. These 9 warning symptoms indicate second stroke is threatening or actively occurring. Severe headache, vision changes, weakness, speech problems, dizziness, confusion, swallowing difficulty, facial numbness, and intermittent weakness all demand immediate 911 calls. Every minute matters. Delayed treatment means permanent disability or death. Which symptom surprised you? Have you experienced any of these? Share in comments. If this saves lives, please share. Subscribe for life-saving medical content. Thanks for watching.